Pertussis, vaccinating for the future. Pertussis can be a very serious condition and deadly, but is 100% preventable if parents and/or guardians follow proper vaccination schedules laid out for them by their child's pediatrician. In order to prevent an epidemic and hundreds of unnecessary deaths, it is vital that a parent knows and follows the appropriate vaccination schedule to prevent pertussis in their children, the community, and in this case, the state of Washington. It is the responsibility of the parent and/or guardian to provide proper vaccination for their children in order to keep them healthy, safe, and allow them to live long, prosperous lives. Pertussis, better known as the whooping cough, is a common endemic disease within many nations, including the United States. Whooping cough is officially labeled Bacterium Bordetella pertussis and can be medically treated with antibiotic therapy. It occurs in adults and children who become exposed to the bacteria and exhibit such signs and symptoms as a runny nose, congestion, and coughing. These symptoms will persist and deteriorate to the point of violent coughing fits, pneumonia, and periods of apneic breathing. This highly contagious disease is particularly harmful to young children and babies whose difficulty in breathing can lead to death. The large incidence in the transmission of pertussis in Washington state is due to the increased rate of parents choosing not to vaccinate their children or delaying the recommended immunization time schedule for vaccinations. Highly publicized reports in the media have given rise to the fears associated with vaccinations and the link with autism. Although this information has proven to be false, those in medical leadership positions have persuaded and played on the fear of parents. Very few children in the state of Washington are completely covered under the timetables of pertussis recommendations. In fact, during the year 2012, only 65% came close to the state goal of 80%. Washington State is currently working in collaboration with local health agencies, medical providers, and parents to turn around these numbers. The spread of pertussis can be greatly decreased with vaccinations starting from age 2 months through adults. The DTaP is available for infants through 7 years of age and given in a series of 5 injections spread over 6 years. Follow-up vaccinations, which continue over the age of 7 to adults, are called the Tdap. Each series of injections is intended to build up protection against whooping cough. The best defense against pertussis is through herd immunity. Herd immunity requires that 90% of a population must be immunized to provide protection from the transmission of disease. Although there was a spike in the number of cases in 2012, statistical data points to the fact that the number of reported cases seems to be going down as health information improves. The most recent years show a dramatic decrease from 2011 as newer methods of prevention are discovered. However, 2012 showed an obvious spike in the reported cases of transmission of pertussis. This information shows that there is an obvious need for the continued health education and prevention methods to further control or eradicate this condition. Pertussis became an extreme concern in 2012 when the state of Washington labeled the severe outbreak of whooping cough in their state as an epidemic. This outbreak peaked at 4,916 cases reported since October 1st, 2011 through December 31st, 2012. Numbers this high had not been reported since the year 1941. During this time period, it was found that young children were the hardest hit group afflicted with the pertussis, and the CDC set their goals on decreasing the morbidity and mortality of whooping cough for infants, children, and adults. Monitor health. This is done in order to identify and solve any outlying community problems, and in our case, pertussis in the state of Washington. Monitoring the health of the community is completed in order to identify possible health risks, determinants of health, and the determination of health services needed in order to prevent the outbreak of an epidemic. epidemic. Use of statistics to determine groups that may be at a higher risk, identification of community assets that promote health and improvement of quality life, and collaboration to determine and establish health registries in order to track outbreaks and cases throughout the community. This area is essential in understanding how, where, when, and how many people pertussis affected. This section will help give the answers needed in order to bring the epidemic or possible outbreak to a stop when you know the origin of who it affects and why it affects them and the reason for the epidemic. It is easier to prevent it and bring the epidemic to a stop. Diagnose and investigate the health problems and potential hazards that may play a major role or factor into the epidemic at hand, pertussis. This section is vital in the timely identification and investigation into the pertussis outbreak. The access and availability of diagnostic services and response plans that are in place to address the outbreak and prevent infection of a much larger population. It is important to know exactly what disease is affecting your community and are able to properly and quickly identify the disease, and that there must be a plan in place to stop the disease from affecting an entire nation. These are only 2 of the 10 essential public services laid out for a community by the National Public Health Performance Standards to protect the well-being of that community. The epidemic outbreak of pertussis in Washington took the state completely by surprise in the year 2012. In the 1940s, thousands of deaths occurred each year from pertussis, but were greatly decreased with the introduction of a vaccine. These numbers once again greatly increased during the year 2012 when the state of Washington started reporting weekly infection rates of 256 persons. Washington State realized with the impending epidemic, the issue of controlling and preventing pertussis must be addressed. The intent in addressing pertussis to the public is conveying the disease is preventable. The focus in understanding and overcoming whooping cough is the battle of pertussis is winnable through education, awareness, and vaccination. Lack of education surrounding the need for vaccinations has been an obstacle the Centers for Disease Control and Prevention, along with state health department officials, have worked to address with the public. Educational programs, literature, and public service announcements are some of the ways support is being accomplished throughout communities in the area of childhood vaccinations, well childhood visits, and the need for timely boosters. National level involvement has come from the Centers for Disease Control and Prevention with such programs as the National Infant Immunization Week. This is just one of the ways the CDC emphasizes the importance of protecting infants, children, and adults from preventable diseases in this country. Partnering at the state level, the CDC also provides such information to the public on vaccination recommendations, vaccine safety, information of the disease process, as well as videos that aid in recognizing the signs and symptoms of pertussis. Local level involvement also exists with such organizations as the March of Dimes and P-Kids Online, who have made it their mission to educate the public on such infectious diseases like whooping cough. Using high-profile celebrities in their public service announcements, they are able to convey the vital importance that awareness and prevention contribute in fighting the disease. DTaP and Tdap are key component to treating whooping cough. The pertussis outbreak in 2012 emphasized to the state of Washington the importance of reaching the public on the need for more awareness and prevention of disease. Major vaccination campaigning throughout the state occurred at all levels. Awareness and prevention posters blanketed the walls of establishments throughout the communities, from merchants, schools, and healthcare facilities. The objective became providing awareness to the disease of pertussis, offering advice and testing locations, and vaccination recommendations. This massive campaign effort resulted in successfully reducing the incidence of people in Washington state infected with pertussis. It also brought to attention the fact that communities must be given the tools and knowledge to overcome infectious disease. Washington State has been known for having vaccination rates well below the national level for children in their state. This is partly due to parents who choose to opt out of vaccinations due to personal or religious beliefs, but mostly applicable to parents not fully adhering to the regular vaccination schedule. Overall improvements have been made possible through Washington's Universal Childhood Vaccine Program. This program is ran through the State Department of Health and provides vaccinations for all children under the age of 19 free of charge, no matter their financial ability or inability to pay. This program has been a contributing factor in protecting children from pertussis in the last couple of years. In the year 2012, pertussis outbreaks reached a high of 256 in a one-week time span. As of April of this year, that number has only been reported at 29 cases. These lower numbers are encouraging for the state of Washington, but also a reminder in the importance of keeping the public well informed and aware so that future outbreaks of pertussis do not become an epidemic. Currently, there are no policies pertaining to pertussis directly at this time to prevent this disease. There is a recommended vaccination schedule, but it is the parent's choice if they choose to give the child the vaccination. Currently, the CDC offers recommendations that include avoidance of individuals that may have the disease, isolation and antibiotics for 5 days, and a 14-day course of erythromycin. The disease typically lasts 10 weeks if treated properly. Pertussis can be treated by clinics, physician offices that specialize in internal medicine, and hospitals. The affected stakeholders over these groups would be the board of directors for the hospital and clinic groups and the individual doctors that own their practices. In the case of the individual doctors, they are both the stakeholder and the facilitator. Make sure you explain how the 3 essential services fall in the policy development category and are applied to your health problems. Setting up mandatory vaccination schedules for pertussis will be a key in creating a controlled method that will best treat the illness while still being considerate of the stakeholders' point of view, along with the ability of the health staff to execute the schedule. According to the CDC, the following graph shows the vaccination schedule for pertussis to be administered properly. Precautions have to be taken and put in place in the event that the people who are caring for those with pertussis were to contract the illness themselves. These precautions would be a necessity, as with any illness that is communicable. Our facilitators are at a higher risk of contracting the very illness that they fight. Creating a set of precautionary measures and what-if protocols so that the illness does not continue to spread outside of the environment of treatment. Having healthcare providers pre-vaccinated prior to giving care is one method of doing this. Caring for those affected is not the only focus of care. Anyone that an affected person comes in contact with has a high potential of contracting the illness or becoming a carrier in which they spread the disease to others. This would cause a random rate of exposure that must be controlled through the setting up of proper policy in the pre-treatment, ongoing treatment, and infected treatment of patients. This is why it would be essential in creating a policy and discovering all the patients that have been in contact with during a set period of time and as fast as possible in order to track down those people and possibly get them in for treatment as well.